Hello again, everyone. My name is Marty Guthmiller, and I'm the CEO at Orange City Area Health System, bringing you today the 34th edition of our COVID-19 community briefing. I'm not going to start out today because I don't have any data on a local scoreboard, so no update on that. But at the same time, they largely just be numbers today because from my understanding and knowledge, there's nothing significant that would change other than just the pure numbers. And so I'll bring that to you probably on the next briefing. I would like to offer a reminder, though, that what we talked about on Monday was our serology testing to the public. That is the antibody testing will be available beginning this coming Monday, July 6th, at our walk-in clinic location. And that'll be from in the hours of noon until 4 p.m. You don't need an appointment. You don't need to pre-call. Just show up and you can have that test performed. There's a $60 charge for that, and that is a cash upfront charge. Insurance is only applicable in a situation where you have a diagnosis, and that would be in conjunction with a regular clinic visit. And so if you think you do qualify or there's some insurance applicability, that would need to be performed in conjunction with a clinic visit here at the health system. So $60 this Monday, beginning this Monday, noon to 4 p.m. at the walk-in clinic. Just some information statewide on this serology testing. They're fairly early in the game on this. There's really only been just short of 33,000 tests across the state. 32,813. And the positive rates so far of those 32,000 tests is 7%. So there's not a lot of antibodies out there, but if you want to know and to use for future benefit, those testing, that test will be available beginning here Monday. I'm going to step up to Sioux County at this point and give you some numbers. 455 positives in Sioux County. That is +9 from where we were on Monday. 2,870 residents of Sioux County have been tested. That is a 1 out of 12%, or 1 out of 12% tested for 15.9% positive rate, which is the same rate that we talked about on Monday. So if many of you know, the positive percentage rate to me is one of those indicators of what's going on. That's a little bit higher, of course, than what the state is. And we'll talk about that in a second. But it is coming down, or at least staying steady. Moving on to Region 3, the 20 counties in Northwest Iowa, 33 are currently hospitalized. That's up just a little from Monday at 31. 5 have been admitted in the last 24 hours. And that is, again, the same number that we had on Monday, I believe. There are 12 patients currently in the ICU, and that is up from 7 on Monday. So not great news in that regard from 7 to 12, but still relatively low numbers. Just in terms of Region 3 availability, again, when you go back to flattening the curve way back when, were we successful in that? Yes. What the goal was to elongate the infection so that we wouldn't overwhelm the systems. There's currently a lot of capability in Region 3 specifically. In Region 3 only, there are over 500 beds currently available. And there are 89% of all ventilators in Region 3 are available as well. So clearly the capacity is there. We know more about treating the disease as well. So this flattening the curve, if in fact we were successful in that, it has proved to be worth it in terms of we have better treatments today, not definitive ones or not a vaccine, of course. But we know more about the disease today. We have ventilator capability. We have other techniques. And so that has been, by all measures, a success. Iowa, as a state, has 29,291 positives of the 308,660 that were tested. That is a 1 out of 10 rate of testing for all Iowans. The positive rate at Iowa, within the state of Iowa, is good at 9.5%. That is down from 9.6% just on Monday. As you know by now, one of the measures I look at is hospitalizations and the hospitalization rate, particularly in Region 3. Region 3 today lists 133 hospitalized COVID patients. That is up 8 from Monday at 125. As important as Region 3 is, it's even more important to get closer to home with hospitalization rates. Sioux, O'Brien, Lyon counties continue to have 0 hospitalized COVID-19 patients. Plymouth County has 4. That number is up from 2 on Monday. Clay has 0. Dickinson County has 1, and that's up from 0 on Monday. And the reason I mentioned Clay and Dickinson, we had been hearing some things about nursing home outbreaks, places at the lake shutting down, things like that. The positives are there, but apparently with lower acuity, as it is not manifested in hospitalized patients at this time. The good news continues in Buena Vista County. They are down to 3 patients now at BV County. Woodbury County is actually number 2 in the state in terms of hospitalized COVID-19 patients, but only at 16. And that 16 is down from 18 on Monday, so heading in the right direction. Polk County, which is number 1 in the state with hospitalized patients, had a spike this week a little bit, or since Monday. They have 31 patients currently. On Monday, we reported 21. And so Polk County is number 1 at 31 patients, Woodbury County number 2 at 16, and just in case you're wondering who's number 3, I believe it was Floyd County, but I know the number was only 6. So you're dropping off to the 3rd highest county in the state being at 6 patients, so that's significantly different than what it was before. I've been spending a little bit of time lately talking about the number of deaths in Iowa, in part because I think it's important to understand that while things are improving, this thing isn't over, and it's not a sprint, it's a marathon, and all those kinds of analogies. We've had 10 additional deaths since Monday in the state of Iowa. We're at 717 deaths. I'm going to talk a little bit more about the specifics of this, not necessarily to focus on that, but to focus on maybe perhaps what this does not represent. The 717, when you look at the statistics, and again, you can go to coronavirus.iowa.gov and look at these things for yourself. It continues to trend down, but obviously any death is very real and still needs to be taken seriously. The thing, though, that the statistics point out is that this is very, very much a older person disease, and it is very much a disease that affects negatively those with pre-existing conditions. The stats clearly bear that out. 88% of the 717 deaths are on 61 plus. And it's a little over half of that number is, I believe, over 75 or something like that. But 61 plus is 88%. 10% of those are at age 41 to 60. 2% are 18 to 40, and 0% under 18. And so when we think about this, that has to come into factor, I would assume, at the state level, at the local school district level, when we look at the acuity level and the consequences of not having kids back in school, that kind of thing. I would sure think that this would have to come into play, and at least in my opinion, should be factored into the equation. Looking at the pre-existing situation there, over 70% of the deaths have known pre-existing conditions. Known pre-existing conditions. A number, 23% more are unknown. Only 48 of the 717 deaths in Iowa, 48, are completely unrelated to pre-existing conditions, where there are no known pre-existing conditions. A full 93% were either not able to identify pre-existing conditions, simply don't know, or definitely had them. So again, it just brings up another reason to, as we've talked about, keep that engine tuned. Lose some weight, keep your wellness activities going. Includes blood sugars, blood pressure, those kinds of things, immunizations. Keep getting all those things tested, worked on. Besides distracting you a little bit, it's really the best thing for. And you know, this kind of lifestyle and those kinds of pre-existing condition attention apply to every virus that's out there, not just the coronavirus. So generally speaking, healthier people can get through situations. It just makes common sense. So pay attention to those things, get out, live your life, use common sense. Again, these deaths are real. I don't think we need to live in fear at all. Not at all. We need to get about living our lives. We ask that you stay vigilant, stay strong, stay healthy, and thank you for joining us. And we'll be presenting the next edition in the next day or two. Thanks again.